So we're going to talk here about trauma screening and assessment. What is the difference between screening and assessment? A screen is a brief instrument or questionnaire or a series of questions that is meant to rule in or rule out a problem. An assessment then is used on those for whom the problem is ruled in, and that is a more in-depth exploration of the problem. So trauma screening is something to do with every single client that comes to your place, and assessment is to do with those who, due to the screening, show to have had trauma in their background. And we're particularly focused here on screening and assessment for children and adolescents. Universal screening is highly recommended. It not only finds out for you who your clients are with trauma histories, it also establishes right at the beginning that you're willing to talk about these things, that that's part of what you're here for and that you're comfortable with them. It helps you to avoid misdiagnosing people and to offering treatments that hurt them rather than help them. It also helps you develop data about the prevalence of trauma in your population, which can help you in shaping the services that you offer and also advocating for funding. So screening is a brief focused inquiry to find out whether they have experienced trauma events. Then assessment is more in depth, and this looks at the nature and severity of the events, what is the result of those events, and what symptoms are the person having right now. There is actually a movement now to mandate trauma screening from all pediatricians on all their kids. A main leader of that movement is Nadine Burke Harris, who is now the Surgeon General of California. She is implementing a process to start this in California where all pediatricians do a trauma screening on all their clients. That's her point. She has a wonderful TED Talk, which I highly recommend. And as she says, we screen for things that happen within 1 out of 1,000 in the population. Why are we not screening for something that is so much more prevalent? So again, the screening helps you decide who has to have the assessment, and the assessment helps you make sure you're doing the right treatment. So the questions about trauma should be part of the routine intake, not just in mental health, but also in juvenile justice, child protection, I said, pediatricians, and some have even said schools, anywhere that children enter the helping system. The fact is that if we don't screen for trauma, we will grossly underestimate the prevalence of trauma in our populations. It's only once we start doing universal screening that we realize how high the prevalence is, as this study shows that 98% of patients in a certain program had a severe trauma, even though their diagnosis was schizophrenia and bipolar. I think this is less common now, but it was quite common to dismiss patient stories of abuse. Of course, the person who started all that was Freud, who talked about all his women imagining child sexual abuse, although in fact they were experiencing child sexual abuse. So if we don't ask about it, we not only don't know it's there, but we also give a message which the patient has heard from many other people, that this is not something we can talk about. This is not something that you deserve help with, and it's somehow your fault, or makes you less of a person to have been abused. So one of the things that's a very important distinction to make in screening and assessment, especially assessment, is that there's a difference between assessing what happened to you and assessing what are your current symptoms. The type of questionnaire that asks about what happened to you is very important and can help you become aware of what your client has been through. However, it's not something that can be used in any outcome measures or done at periodic times because, of course, whatever happened to somebody already happened and you're not going to change that. It's an assessment of their current symptoms that is important to do at the beginning and perhaps later in treatment to see whether what you're doing is making a difference. So there's also, I guess it's also kind of a screening that we understand that certain symptoms tend to reflect early abuse, and so when we see those symptoms, we look further for abuse as long as we actually do it. For instance, we probably all would agree that someone's reaction to being restrained would be different if they had been sexually abused or if they had been restrained and then beaten early in their childhood. Yet, if someone was very reactive to being restrained, do we just think that that's who they are, or do we actually look at whether that's a result of past abuse? Of course, as we're screening, we can't neglect what is their current reality, because sometimes when we think about screening, we think about the past, what has happened to them in the past. It's also essential to know what's happening to them right now. Are they right now living in a dangerous environment, an environment with physical abuse or domestic violence? Not just abuse against them, but abuse against other family members as well. We want to look closely at what is the current environment, because if they're currently living in an unsafe environment, it's not going to do any goods for us to be trying to help them treat the symptoms of their trauma, because they're getting more trauma every day. Furthermore, in doing this kind of assessment, we have to consider external to the family traumas such as racism, dangerous neighborhoods, poverty, and bullying and attacking of gay and lesbian, etc. people. We have to consider the outer world as well as the family world. We have to consider the result that racism is having on our client. Is the client experiencing, well, if they're a person of color, they are experiencing events each day in which they feel devalued or unseen. So all of this is essential in evaluating the child's current reality. So it's hard to do screenings because trauma can be so many things. Trauma can be, as I just said, many things in the home, many things outside the home. And also it makes a difference how old the kid is. Different things are traumatic or are particularly difficult at different ages. And also cultures are different. So it's not a simple thing to do a screening or even an assessment. And of course, we do have to pay attention to the child's social system, both now and in the past. Were they homeless? Were they living in severe poverty? Again, I mentioned racism. So how do we screen for all these things? These are a lot of things. And yet, are being aware of the life this person has led, what has happened to them so far, really helps us understand what views they've formed of people, what they expect from us, what they've come to learn about themselves. The more we can know about both their past experiences and their current reality and their symptoms will help us to target our approach in the best way. Certainly, when we're working with children and youth, the assessment has to include their families. The older children can also report for themselves, but it still needs to include their families. And as we're doing the assessment part, you'll have to decide or your agency may have a protocol for whether you see the child and the family together or whether your assessment includes periods with each by themselves. Because of course there's things that each could say when the other isn't present that might be important to know. For instance, maybe the child will tell you about something that's happening in their home that they couldn't speak about if their parents were there. Or maybe the parent will be more able to give you a complex understanding of what their family life has been if the child is not present. So it's probably a good idea to have time in which the family is all together and separate time for the child and the parent. So there are some measures that are well known and that can be used. The first one is one that talks about past history. Just tries, and interestingly, it brings in other traumas than ones we generally know, such as it's important to have an assessment tool that doesn't just ask about things like child abuse, but also asks about things like being in a serious car accident, being in a fire, having severe medical problems so that you maybe had to have an early operation or a hospitalization. All these things are evidence of trauma as well. Then, of course, we want to look at the symptoms, and there are some well-known symptom checklists that you can use, and perhaps your agency generally uses one of these. These are the kind of instruments that can be used as outcome measures so that you can see whether the symptoms decrease as a result of whatever intervention you're doing. There's also structured interviews, where you completely follow a certain guideline so you make sure you don't miss anything. And then the parenting stress index isn't exactly about trauma, but it's about how much stress the parent is feeling at this moment, both from the child's behaviors and from other things in their life. So NCTSN, the National Child Traumatic Stress Network, is a SAMHSA program that has given grants to many agencies throughout the country and has developed an incredibly wonderful resource in its website. The website, nctsn.org, has basically the results of everything that has been learned through all these centers. And of course, everything that's on there is free for your use, because you might say you already paid for it since it's the federal government. And it has lots of helpful tip sheets. It has a list of evidence-based practices for various issues. It has several curriculums, like one for foster parents, one for child welfare workers. So it also has a list of measures. So please get to know NCTSN. This says nctsnet.org, but nctsn.org works too. So we have measures and we need to use them. It's not going to help us just to close our eyes and not see the abuse that's there. One of the main barriers to screening is people feel like, well, if someone screens positive and if an assessment shows a trauma history, then what do we do? Well, that's an important question. We need to know, what do we do then? We then have to have skillful, careful treatment based on what we know about what heals trauma. That's what we're talking about in the rest of the class. But that's one of the main barriers for pediatricians, because they're afraid that they'll find a lot of positives, which they will, and they won't know how to help the clients with them. But one reason it's very important that pediatricians do screening is because of what we know from the ACEs study, that abuse changes the child's medical situation and vulnerabilities. So it's not a matter of saying, okay, if we screen, we won't know what to do. We need to learn what to do and develop resources so that when we screen and when we find children who are experiencing abuse and who have experienced abuse, who are living in dangerous situations and or who are having symptoms, that we know exactly what to do. Thank you.